All right, let's move back to our main story. 22 people in South Africa have died of cholera, 21 of them in Hammanskraal. We know that there's serious concern about what is going on in Hammanskraal. The source of this cholera outbreak has yet to be identified. We know that this evening health officials are gathered at the Jubilee Hospital. We are awaiting a briefing which is due to get underway fairly soon. But in the meantime, the Health MEC here in Gauteng has agreed to join us. Nomantu Nkomo-Ralehoko joining us now. MEC, I really do appreciate your time. We know this briefing is about to get underway, but I want to understand why people are dying of cholera while in hospital, because my understanding is it's an illness that causes very quick, very severe dehydration. So surely once you get someone into a hospital and get them onto a drip, they're fine. Why are people dying after days in hospital? I think you muted yourself, MEC.
You know, Sally, the other thing that we've picked up was the clinical managers had to check on the files of each patient that we have admitted. Apparently, some of them have underlying issues like some of the comorbidities. So immediately now this cholera gets to them, they find them very weak, and some of them are leaving us because of that. For example, we had children that were in the hospital. They were discharged. They didn't stay long, and it's exactly what we are saying. So it depends now on the cases of each patient, how long the patient has been there. Even now, tonight, Minister was taking rounds, checking some of them with the doctors, and some of them, they are recovering nicely, but there are those that you can see that they still need some attention. And some of them we've taken them to Steve Biko and Dr. George Mukari. And those, most of them, yesterday I was there, and most of them have been discharged. Some are recovering nicely. So it depends indeed on the type of a patient. When it gets you and then it hits you hard, and then if your immune system is a little bit weaker, and then it takes you. But we need to prevent that, Sal. It doesn't promote us to let it go like that. So that's why we're trying all the measures that we can. Tomorrow we'll be opening a site at Kanana area, because that's the area that we have 90% of the patients that are coming from there. So we're opening a site there that we are going to make sure that everyone that is around Kanana, once they feel that they're a little bit dehydrated, they have a running stomach, we will definitely check them in the site, not to wait for them to come to the hospital. But even in the hospital now, we have a specific area that we've designed for them so that we immediately attend to them and not wait until it's late.
I want to get a sense whether hospital admissions for suspected cholera at Jubilee, are they on the increase or are they on the decrease?
They are on the decrease now. Before, the numbers were high, but yesterday and today the numbers are going down, which we were really happy about that. But we still believe that let's get into the areas where some of these patients are coming from, even if we're getting a number that is decreasing here, because we still need to know what is it that has made this cholera in these specific areas that have been identified.
Yeah, in fact, we were told that the NICD would probably have located the source of the outbreak by Wednesday. We still haven't heard. Are we going to find out this evening? Do we know the source of this outbreak yet?
We've not got the results from them, but I'm sure maybe tomorrow we'll be getting the results, because we're calling them even today to speed up the process of getting those results, because this is an emergency.
Yeah, absolutely. Is it safe to say, with the declining hospital admissions, that the cholera outbreak in Hammanskraal is under control?
We want to say that, Sally, but I'm sure maybe tomorrow we'll definitely say so. If we don't have people that were admitting with cholera, we will be grateful. We are praying hard that this must pass, because we're losing a lot of people. Activated our war room, which is our command center. So now we are ready. So, but what we have been saying to the team, let's arrest it in Hammanskraal. It must not go to other areas, because if it goes to other regions, we will be in a serious problem. But everyone is ready, even in other regions. We've told them that must be at the alert. Any person that comes, they must attend to that person. In fact, we are saying nobody must wait now at the accident and emergency area. All patients must be attended to, and we're beefing up our teams in those specific areas so that they don't stay long, even if they don't have cholera. But we need to now to have sense of agency when we see our patients.
We know that Hammanskraal is an area with really difficult water supply issues. We've gone into that extensively. We know that the city of Tshwane says do not drink the tap water just in case. But we know there are real problems. How difficult is it to spread the message of wash your hands thoroughly all the time, wash all the fruit and vegetable you eat, be careful of contaminating surfaces? How difficult is it to spread that message as the health department, given the existing problems?
The teams have been there. They are not stopping. We are working everywhere. We have instructed them to do door-to-door, house by house. They are working with the councillors, and NGOs now are joining. So we're all in this thing with them. Everybody in the community understands the need and the importance of assisting us to teach the communities, to educate them in particular. We're even going there with some buckets of water and how they must wash those hands, and they're appreciating that they are doing it indeed.
Yeah.
It can be easy, Sarah. Sorry, I don't want to lie to you. It can be easy, but our community health workers and they are working flat out now. Remember, they've been doing these rounds in the communities, making sure that they even distribute the medications. But now they are doing this one. You can go and distribute the medication as we are doing, but Liz was saying they must focus on this project. And we've taken out everyone in the office under health promotion team that they've been working with me. And we have a plan of making sure that we are localizing the health system. Because remember, there were those road shows that I've been doing in the communities. But now we're intensifying those road shows on health promotion. And quite a number of NGOs that are working with us, we've brought them on board. They are assisting us. So it's difficult, but I think now people can see the seriousness of the issue. You know, so when you see a neighbor dying, and then you know that Uncle so-and-so is no more, we definitely know now that it can come even here at home. So that's why everyone now is serious about it, including the issues of water. We're assisting on the distribution of water. Bottled water, you have seen, I think even the NGO that is always helping us.
Gift of the Givers was there as well. I want to
Gift of the Givers, because they are working very close with us. They gave us a lot of water.
So there has been a lot of assistance, but you did say that the source has not yet been identified, which of course is the worry, because then you can't control the spread, you know, knowing where the source is. But while we await those test results, I would imagine that that officials have been speaking and doctors and nurses have been speaking to sick patients and getting a sense of where they've been, very much like we saw in COVID, that sort of track and trace. You know, have you been washing clothes in the river? Did you go swimming in a local dam? What picture are you building up? Are you building up a picture that it's probably in the open water areas such as rivers and dams? Or is there a possibility that it might have been somehow contaminated tankers or even taps?
The municipality, today we had a meeting with the national government and the municipality, and they were giving a report that, because the instruction is that check every tank that gets in now that is bringing water, because we may not know what is the source indeed. So they are doing that, they're investigating everywhere, including these ones that are bringing the water now as we speak. We're saying they must be checked. Anyone that brings that water must be checked if it's the right water. It's not the water that is contaminated, because maybe you can find out is that water that is contaminated. So the team was giving us that report that they are doing that, because we're meeting now with a technical team on daily basis, and they give us reports on what they are doing. We assess and make sure that, but in all of us in these assessment meetings, we end up agreeing that there's still more work that must be done.
Yeah. I wonder if you could just chat to us a little bit more about the cholera patients who are still in Jubilee Hospital. You did say that the acting health minister, was quite keen to sort of catch up with them and see how they're doing. Very sadly, in the last few days, we have seen more deaths. 21 patients at this hospital have now died. Are any of the remaining patients in a critical condition, or are all of them on the road to recovery?
No, all of them, they are stable, Sally. They are talking. We're even laughing with them, because they are saying, come in and touch me. They were telling Minister, everyone, come here, come and touch me. You're touching the others on the other side. Come to me too. But they are all stable. You can see that they're looking forward to going home, but we will observe them. We don't want to release them immediately. Even tomorrow, you will still find some of them here. Good thing is that we save more space, and we have medical team that is assisting them. So on our side, we are fine. There is no agency of taking them out so that they can be complicated after they've left the hospital.
There was a lawyer on eNCA and saying that someone has to answer for these deaths. If we look back at the history, we see that there's been a failure at levels of government to deal with this, and it's across a number of parties. It's not just the ANC. Also, there are fingers pointed at former DA mayors. It certainly seems like there's a movement now to work together in the municipality. But the reality is this is a problem that for many years has been neglected on many levels of government. It's a failure and it's shameful. Do you believe that finally this problem will be sorted out in Hammanskraal, and do you believe that heads should roll over it?
I think the problem will be sorted out in Hammanskraal, but I think again people have the right really to raise those issues because of the problem that it has caused this issue. And I think it's a sensitive issue, but definitely because even the national government, they said that there must be accountability, which I agree on some of these issues. Can't lose so many lives and then suddenly will keep quiet. Definitely something must be done on our side. And the Minister of Water and Sanitation is also handling this matter. In fact, they were upfront, the Department of Water and Sanitation. They were very upfront. Deputy Minister Mahlobo, from day one when we met, he raised the issue of accountability because he says this issue has been long and national government wanted to intervene. So definitely something is going to be done. And we all agree with that.
All right.
Because that's what even South Africans will want from us.
Yeah, absolutely. Thank you so much for your time this evening. Much appreciated. That, of course, is Gauteng's Health MEC, Nomantu Nkomo-Ralehoko. Now,